I just came off of two 12-hour shifts yesterday and today. I'm able to be off today, but there was once again a need. So after I'm done talking with you, I will likely go in and help out my colleagues who are running short.
When I work in the medical intensive care unit here at Harborview, my day usually starts around 6:30 in the morning. A big change for us has been not having family members so readily available in the hospital, and so spending more of our day on the phone or on Zoom, connecting with family members to give them updates and wrap up my day typically 12 to 14 hours later. When we work in the intensive care unit, we tend to do 7 or 8 days in a row like that.
The second wave feels completely different than the previous wave.
I had a family member I texted with this weekend, and she basically said, I'm too old for this. She's an ER doc on the front line.
Within my hospital, quite a few of the nurses quit.
A lot of nurses are burnt out. I have access to hundreds, thousands of nurses on social media, countless comments, countless messages telling me I want to leave the bedside. I don't know why I chose this. Like, I'm so tired. I feel exhausted. I don't know what to do.
I've definitely had colleagues that have retired early, others considering part-time work and just reevaluating their priorities.
We lost some moms who had to face the choice of either continuing to work or to focus on what was most important, which was the success of their children in school.
But yeah, it's scary. At home, I wear a mask. I try to social distance as best I can while not giving my 5-year-old permanent damage from not having any cuddles with mom. And then I'm breastfeeding. So I have chosen to continue breastfeeding. I don't know if that's the right answer. Obviously, she's getting exposed to a higher degree than the rest of my family. I'm just kind of hoping that if I get in, I'm creating antibodies that'll help protect her as well, but nobody really knows that.
I want to say at least a dozen of my colleagues within our own department were furloughed or demoted.
We do not have enough beds, and we do not have enough high-flow nasal cannula. We do not have enough ventilators. We do not have enough ICU. And by that point, heck, we might not have enough physicians.
Then you have nurses who are seasoned, who've worked for 20, 30, 40, 50 years. And when they're leaving the bedside, it's just us. Some nights I'm the most seasoned nurse on a unit, you know what I mean? And that's crazy because I've only been working 2 years.
We already are full. We're completely full. And my pregnant mom, who has a chance of needing a high-flow nasal cannula, at that moment that we were talking about it, there wasn't one. There's not a ventilator or not a high flow. Like, are we going to try to get somebody else off of it to get my pregnant lady the oxygen? I mean, we haven't had to make that decision yet, but we came really, really close.
Why we are in the middle of a respiratory pandemic, battling a respiratory virus, it doesn't make any sense to furlough and consider furloughing respiratory therapists.
I think I've learned about myself that I'm able to do more than I ever thought I could do. There's always been challenges for me in balancing my work life and my home life, and both have had things added to them over the course of this pandemic. And so I guess I'm proud that I've been able to stay afloat.
I've been talking with a lot of my colleagues about how the public is saying thank you for being on the front lines.
I've been thinking a lot about how the intensive care unit is more than just a place. It's really made up by all the people who work there. Nurses, respiratory therapists, pharmacists, dietitians, environmental services, food services, and countless others.
They're writing us thank you notes and sending pizza. And at this point, we just feel like we don't need any of that. what we need is for you to stop exposing us.